and hit the record button. Recording in progress. So that means we're getting started. Welcome, everybody. Thank you so much for being here. This, I promise, is going to be one of the most informative webinars that you will see like ever. We have with us today Andy Hardwick. I'll go through a couple of quick housekeeping items and a couple of slides regarding Consolidated Planning Group. And then I'm going to turn everything over because I know you're not here to see me. So Andy Hardwick is fantastic, educational. You're going to love this webinar. He has so much useful information. Unfortunately, he is retiring and we won't have him with us available for very much longer. So we wanted to take this opportunity to thank him so much for being part of the special needs community and helping out so much. Andy, you are truly going to be missed.
Thank you.
The webinar today, we are recording it. We will send an email afterwards with all the information you're going to need and a link to this webinar, which will be recorded and will be put on our YouTube channel. So don't worry about that. Your microphones and your cameras are turned off. We cannot hear you or see you. If you have any questions, please put them into the chat box. We know there's going to be a lot of information given and a lot of questions, and we'll get to as many as we possibly can. So I already put my contact information in the chat box. So if you can refer back to that, and it's here on this slide as well. I'm Michelle Morris with Consolidated Planning Group. We are a holistic financial planning firm that focuses on families with special needs loved ones. We help plan financially and of course in other ways for families with special needs. Some of the things that we focus on: protection for you and your family and your loved ones, lifetime care, how much is that going to cost? You know, we can do a cost estimate for future special needs care. Transition planning, we help with that. We help with ABLE accounts and wealth and life insurance and not only that really, but everything through the lens of having a special needs loved one. So we truly take a path of advocacy and education. We want to help. We want to be there for our clients, helping with things like waiver benefits and Medicare and Medicaid, and of course SSI benefits and everything that Andy's going to talk about. Again, just feel free to put your questions in the chat box. At the end of this presentation, if we get through all of it, I'll have a little bit more information for you. But I really just, like I said, I know you're not here for me. So I'm going to turn everything over to Andy. I'm going to stop my share and let him get going. Please put your questions in the chat box. I will be monitoring and I will try to stop Andy and get to as many questions as we can. So Andy Hardwick, thank you so much for being here. We appreciate you more than you could ever know.
My pleasure. My pleasure. Thank you very much for inviting me. Can you see the screen?
Yes, we can.
Okay, good. All right.
Perfect.
Okay, let me get myself off here. I don't know why I don't want anybody to look at me. That's distracting. Okay.
And I'm going to mute myself so that if my dogs start going crazy, nobody will hear them. But I'll unmute, you know, when I see questions pop up.
Okay. My name is Andy Hardwick. I'm a public affairs specialist for Social Security in Southeast Texas. Today, we're going to talk about two programs that are administered by Social Security and are of assistance to people with disabilities. So one is called Social Security Disability Insurance, or SSDI, and the other one is Supplemental Security Income, or SSI. Okay, so let's talk about how is SSI different from Social Security? Well, the SSI, or Supplemental Security Income, requires a person to have limited income and resources. So
Hey,
you
Andy,
may...
we are still we're still seeing, not the slideshow as a full screen, but we're seeing kind of the page before that. So you might need to stop your share and re-up your
Okay.
share.
Okay. So let's see here. Let's see this. Oh, hey. Let me see here. I apologize here. I'm not
Oh,
the-
that's okay. No
not the
problem.
most. Oh, okay. Let's go to enable editing. I think that will do it. Oops. Stop. Windows closed. Okay, we're going to go to this. Hold on a second. Just be patient here. I apologize again. Here we go. Okay, and slideshow. All right.
All
Now,
right.
if I move it, is
Now
it
go
better
ahead
now?
and go to the next one. Make sure you can forward. There you go. Perfect. We've
Okay.
got you now. I
All right,
see
good.
Karen has raised her hand. Karen, if you have a question or anything we can help you with, please put it in the chat box and I can answer everything there or ask Andy. Okay.
Okay, the SSI is not based on work credits, so you don't really need work history to be eligible for SSI, unlike with Social Security. In most states, if you're eligible for SSI, you are also automatically eligible for Medicaid, so you don't have to apply for it. In order to receive SSI, you must be either 65 years old or older, or if you're under 65, blind or disabled. And the SSI comes from general revenues, not Social Security trust funds. It has nothing to do with Social Security. It's an assistance program from the federal government. Okay. Now, who can get SSI? Anyone who is blind or disabled, who has limited income and assets or resources, U.S. citizen, or in some cases, a U.S. resident. If you are not a U.S. citizen, you must have worked in the U.S. 10 in order to be eligible for SSI, or your parents, if you're a minor, must have worked in the US 10 years in order for you to be eligible for SSI if you are not a US citizen. Of course, if you're 65 years old or older, there is no disability that needs to be proved. Now, in order to get SSI, you must be a resident of the 50 states or the Northern Mariana Islands. For your information, the Northern Mariana Islands are in the Pacific, somewhere near Guam, the Philippines, that area. They are considered part of the United States. It's a US territory, and that's the only place outside the US you can get SSI. Puerto Rico, Virgin Islands, even though the residents there are US citizens, you cannot receive SSI while you're residing in Virgin Islands or Puerto Rico. So basically, you have to be in the 50 states or District of Columbia. Now, the definition of disability for SSI purposes and also for Social Security purposes is if a person is over 18 years old, a physical or mental impairment that keeps a person from performing substantial work. Okay, substantial work. I've had a senior moment here, but basically it's about $1,350, something in that area. So if a person is applying for SSI or Social Security and they are working part-time or whatever, and their income is over that amount, over $1,350, somewhere in that range, then they will automatically be denied, no matter how serious the disabilities. Now, after they get approved, after they start getting benefits, they could get up to that amount and even higher and still continue with their benefits. But in the moment that they are applying, if they are working and their income exceeds that amount, they will be denied. Now, for a person under 18, they have to have a marked or severe functional limitation. So we're going to compare that minor child to other children in the community who do not have a disability. And how do they care? Can they feed themselves, dress themselves, use the bathroom? How are their communication skills, et cetera, et cetera. So once they turn 18, then we will determine whether that disability continues if they've been approved, and then we will judge them by adult standard, meaning do we think that they can do some type of work and earn at least $1,350 a month gross. For blindness, for a visually impaired person, they have to have corrected vision of 2200 or less in the better eye, or the field of vision less than 20 degrees. Now, how do we determine if a person is, whoops, I think we went, how do, oops, I think I went, yeah, okay. So how do we determine whether a person is disabled or not? We actually don't make the decision in the Social Security office. An agency of the state called DDS, Disability Determination Services, makes the decision. Every state has a DDS. The DDS uses a manual known as Disability Evaluation under Social Security, nicknamed Blue Book. If you go to Google and you put in Social Security Blue Book, you will see the manual. We don't have hard copies available, but the manual, virtual manual, is available online. But there are two sections, adult and child. Anyone 18 years old or older falls under the adult, and the child is for anyone under 18. And you'll see all the conditions, and basically you'll see what criteria the person has to meet in order to be considered disabled by DDS. Usually it takes 3 to 4 months to get a disability decision, and DDS contacts the medical sources, hospitals, schools, clinics, doctors, all that. Now, if they don't have if they don't have enough information, or the medical sources you have listed or you have given do not respond, then DDS will set the person up for a consultative exam at no cost to you, so that the person can be evaluated. Because sometimes the medical sources you provide either don't answer, or they haven't administered a certain type of test that's necessary to evaluate the person. So DDS will set them up for an examination. Now, there are some conditions. I told you it normally takes 3 to 4 months. Actually, due to COVID and everything, it's been taking probably 4 to 5 months to get a medical decision. But there are some conditions under SSI where there's a likelihood or a probability, a high probability of a person being approved for benefits. If that's the case, then we can, while DDS is making a decision, while they're contacting the doctors and medical sources, we can pay the person conditionally under presumptive disability, okay? So some of those conditions are like Down syndrome, cerebral palsy, HIV, and certain types of amputation. So if, like I said, like it shows here, there's 15 different conditions. So if the person meets that, they can be paid for up to 6 months SSI and receive Medicaid coverage up to 6 months until DDS makes a formal medical determination. Besides the presumptive disability for SSI, we also have for both the SSI and Ssdi program. So Ssdi is the Social Security. So for both disability programs, we have something called compassionate allowance, and that's more than 200 disabling conditions that will also probably result in an approval. So if the person has one of these conditions, as soon as DDS receives the confirming information that this is the case, this is the diagnosis, then they could make a favorable decision in the person's, in the case of the applicant. Now, a person may meet the conditions for disability under SSI, but because SSI is an assistance program, the person that's applying, the applicant, cannot have accountable income of over $841 a month. Okay, so if the If the applicant is receiving Social Security of $1,000 a month, that immediately disqualifies them for SSI, okay, because their income is too high, right? So that's a consideration. Income, resources, those two are important for this program, right? So under the SSI program, we have two types of income, earned and unearned. Unearned income means any kind of income that does not come from work. And that would include pensions, alimony, support payments, rents, interest, annuities, etc. So with the unearned income, we don't count the first $20. So if a person is getting Social Security of $1,000 a month, if we don't count the first $20, that leaves $980. And we would pay the difference between the 841 and the 980. Well, if you subtract 980 from 841, you're going to get a negative figure. That's why the person wouldn't qualify for SSI. Earned income means any income, any kind of wages, self-employment, royalties, sheltered workshop payments. So for that, we don't count the first $65, or if there's no other income, the first $85, and then whatever left is divided by 2, and that's what counts against the SSI. So if a person on SSI were working and let's say earning $885 gross per month, we subtract $85, that leaves $800. We divide the 800 by 2, that leaves $400. That's what would be counted against the SSI. The maximum SSI of 841 would be 400. So the person could still get $441 from SSI and still be earning $885 in wages. Now, limited resources or assets, the person can't have over $2,000. If it's a minor child between the parent and the child, they can't have over $5,000 in resources if it's a two-parent household. If it's one parent between the disabled child and the one parent, they can't have more than $4,000 in resources. Now, once the child turns 18, we don't care about what the parents have as far as resources. So you may have a child that has Down syndrome, and I told you before that would be an automatic approval because that's one of the conditions for presumptive disability. But then you're told at the Social Security office that they don't qualify for SSI. Well, why is that? Well, if it's a minor child, it's probably because mom and dad work, there's too much income or too many resources in the house. But remember, once the child turns 18, all that changes, okay? We only count income and resources of the child, not of the parent. Right, so this is what we don't count. We don't count the home where the person lives. We don't count the car. If there's one car family, the more expensive car does not count, no matter what kind it is. If it's a luxury car, whatever, we don't care. Okay, 2 cars in the family, we don't count the more expensive, but the second car is counted toward that resource limit that I just mentioned. Burial plots, we don't count that. Burial funds, in addition to a person being able to have up to $2,000 in a total of bank accounts, they can have another $1,500 for burial, but it has to be marked for burial. It cannot be used for anything else. However, in addition to $2,000 in bank accounts and $1,500 in burial accounts, they can have an ABLE account, which you can set up with the bank. They can have up to $100,000 in the ABLE account, and those can be used for almost anything on the person's behalf: education, expenses for special needs, clothing, whatever. Okay, special needs trust. So also, maybe your child is a recipient or was awarded in a whatever kind of case, medical case, a large sum of money. You could put it in a special needs trust. However, unlike the ABLE, you don't have as much leeway in how you use the money from the special needs trust. It can only be used for certain things, but the special needs trust is not limited to $100,000. It can be a lot more than that. Okay, so again, talking about the ABLE accounts, as I said, you can have up to $100,000, and the money can be used for housing, education, healthcare, transportation, personal support services, job training, etc. Now, the maximum amount of contributions per year to an ABLE account is $16,000. So if you have several people contributing to that ABLE account, the total sum of those contributions cannot exceed $16,000 for the year. Okay, this is the one that throws everybody for a loop, is the living arrangements. Remember, I told you that we count mom and dad's income and assets, or at least part of them, until the child turns 18. However, once the child turns 18, how do we determine how much SSI they're going to get? Well, we're going to count any kind of income they have. If they don't have any, then we have to determine what living arrangement are they in. Okay, and basically we have two living arrangements under SSI once you turn 18, is living in your own household or living in the household of another. Okay, now living in your own household could include living by yourself, or having rental liability, or purchasing and preparing your food separately, or owning a home, or living with other people and paying your share of the expenses. So let me give you an example. Let's say you're in a 4-person household and the expenses for the food, utilities, and mortgage are $2,000 a month. Okay, I said it was a 4-person household, so 2,000 divided by 4 is 500. That means that a person on SSI would have to be contributing at least $500, or 1/4 of the household expenses. So that would be their share, 500. So if you're taking $500 out of their SSI, and the total expenses for mortgage, utilities, and food is $2,000 in a 4-person household, their share would be 500. If they pay at least that or more, then they're considered as living in their own household, and they're eligible for the $841 a month. But let's say they live in a home where the mortgage is $4,000 a month. And so let's say the expenses are about well, let's say $4,000 a month. Okay, so in a 4-person household, we divide 4,000 by 4. That's $1,000 each. Even if the person were getting the maximum SSI, which is 841, they could not pay their share. They would always be short $100 something, $159 or so. They would always be short. So in that case, they would be classified as living in the household of another person, and then they would only be eligible for the lower SSI amount, which is probably about $200 less than that 841 amount. Okay, so that's the difference. That's the difference there. Medicaid, as I told you before, in most states, being eligible for SSI makes you eligible for Medicaid. You don't have to file an application. The eligibility is made on a month-by-month basis, because if something changes in the month and the person gets income from somewhere, that could disqualify them for a month. Okay, or if there is a month where there is an extra pay period, maybe for that month they have excess income, and that would make them ineligible for that month. But then the following month, they would be eligible again. All right. Under the SSI program, we do a non-medical review of the case every 1, 2, or 3 years. That's called the redetermination. It's a non-medical review every 1, 2, or 3 years. That can be done by phone or in the office. Now, let me just mention to you, Social Security offices reopened in April. Do not attempt to go to the Social Security office without an appointment. Okay, if you get a letter that you're going to have that, the person you represent needs a review of their case, most of the time we can do those by phone. Okay, it's not necessary for you to come to the office. If you're the representative payee, meaning you get checks on behalf of someone who's disabled, who has a disability, you don't have to bring them into the office. You're the representative. You're going to be doing the signing. Okay, you're going to be answering the questions. There's no reason for them to come in, because I know sometimes parents have a hard time. They bring a child with disabilities and the child gets very, very upset because there's a lot of people in the office and things like that, that the environment is unfamiliar. Don't do that. Okay, so you don't have to bring the person in. If you are the representative payee, you'll be doing the signing and answering all the questions. Now, if you don't respond to the request for a review, and if you can't make it the day that's indicated by the letter or the phone call, just contact us again and we'll arrange for another date. But by no means should you not respond at all. If that happens, we'll have to suspend the case and the SSI payments and the Medicaid until we can complete the review. So that was the non-medical review, called a redetermination. Now, the medical review is called a continuing disability review. That's done every 3, 5, or 7 years. DDS will send you some forms through the mail asking for names of doctors, hospitals, clinics, school districts, whatever. Names of medications. Have there been any new symptoms since the person first started getting SSI or Social Security? Has anything changed? Have they developed any new disabling condition? Okay, so that's very important. So you need to fill that out and return it to DDS. If you don't, again, we'll have to suspend the checks and the Medicaid until that form is completed. Now, remember I mentioned that before, that parents are concerned a lot of times if their children go to work. Here in Texas, we have programs where in high school, they encourage the kids to go and work and see what they're capable of and be in training programs and things like that. Well, parents a lot of times panic because they think, well, if they start with that, they're going to lose their benefits and they're going to lose the Medicaid. And that's not true. Okay. The purpose of the work incentive is to see if a person with disabilities can do some type of work. Of course, the goal would be, we would love to see that the person could do work like could be trained to do work like anybody else that doesn't have an impairment and be earning money like everybody else and not have to receive disability payments from the government. But we realize that's not realistic for everybody. But if you take advantage of the work program, that provides extra income for the person, even if they don't get to a point where their benefits are cut off. At least it'll provide extra income for them to do certain things or buy personal things that they need. So these are just some of the work incentive programs we have: impairment-related work expenses, blind work expenses, plan for achieving self-support, continued Medicaid eligibility, and student earned income exclusion. Okay, impairment-related work expenses. These are expenses that the person with the disability has that help them go to work, right? So if the person takes medication or needs special transportation, residential modifications, other things, maybe they can't get to work using public transportation. They need to use Uber because that's the only way they can get to and back to work and back. Well, they can complete a form with Social Security. And if that's the case, if we approve it, then that means that whatever they spend on transportation, special transportation, we would not count that much of their income. So let's say their income is $885 a month, but their special transportation is $400. Well, instead of counting 885, subtracting 85 and dividing by 2, what we're going to do is we're going to subtract 400 because that's what they allege is the cost of the special transportation. We're gonna subtract the 400 from the 885. That means 485. We subtract 85. That leaves 400, and then we divide by 2. So instead of counting $400 against their SSI like we had done, like we've done under the regular SSI earned income rules, we're only counting 200 because they had 400 in expenses for special transportation. So these were expenses that they had to enable them to go to work. Okay. Now, of course, these have to be approved by Social Security, but if they are, that means we're going to be counting that much less of their income, which means that their SSI check will be higher. Okay. It'll be cut less. Right. So another work incentive that we have is called the Plan for Achieving Self-Support, PATH. Remember, I told you that if a person has $1,000 a month in Social Security, and they try to apply for SSI, their claim is going to be denied because we're going to say, well, the maximum amount of SSI we pay is $841. You're already getting $1,000 a month. But let's say the person who receives $1,000 a month in Social Security, Ssdi, maybe under their parent, and they want to go to school, they want to go to college. Okay, so they go and talk with the local college, and they determine that tuition and fees are going to be $1,000 a month. Okay, so they come to us, they write up a plan for achieving self-support, and there's a form that they need to fill out, and they fill out the form, and they tell us that they are going to go to school. They want to be a teacher. It's going to take 4 years, and the expenses are going to be $1,000 a month. Okay, so if we approve that, that means that $1,000 a month that they get from Social Security, we will not count that at all. As long as they stick to their goal of becoming a teacher and they use the $1,000 a month in order to become a teacher, to pay their tuition and fees in school, then we won't count it. That means they can then apply for SSI and possibly be eligible to receive $841 a month. Okay, so that would give them a total income of $1,841 a month. They'd be using $1,000 to pay for their school. Okay, so that's under the PASS program. Then we have student earned income exclusion. If we have an SSI recipient who is under 22 and is in school full time, all right, in college, that's 8 hours per week, grade 7 to 12, 12 hours per week, okay, they can actually earn up to $2,040 per month in wages before we start to reduce their SSI check, up to a maximum of $8,230. Okay.
Hey, Andy, can I just quickly remind everybody that if you have a question, if you just put it right in the chat box, I'll be happy to stop Andy and ask your questions. I see some people are still raising their hands, but with 100 people here, we're not going to be able to have time for everybody to explain their specific cases. So if you could just put it in the chat box, whatever your questions are, we will try to answer those for you. Thank you. And I'm sorry to interrupt, Andy, please continue.
It's okay, no problem, no problem. Okay, so what are the responsibilities of the SSI recipient or the person who is caring for as somebody who's an SSI recipient? You must report changes in income, resources, and living arrangement. Living arrangement means how many people live in the household. Why is that important? Well, if there's 5 people in a household, remember I said that one of the ways that the person can get the highest amount of SSI is paying their share. Well, if there's 5 people in a house and one moves out, now there's 4 people. So now the SSI recipient's responsibility is to pay 1/4 of the expenses rather than 1/5. Okay. If 2 people move in what was a 4-person house, and now there's 6. So now the SSI recipient responsibility is 1/6 of the household expenses. So we need to know about those changes. We need to know about changes in income and resources. Now, again, once the child is 18, we need to know if mom or dad changed jobs, were laid off, got a new job, or whatever. But once the child turns 18, the only thing we're concerned about as far as income and resources go, or assets, are the child's, not the parents. Now, if a child is being raised by a grandparent in a non-parent household, there's no parents in the household, then we are not counting, even if the child is under 18, we're not counting the income and resources of the child's caregiver, the parent, the grandparent or the aunt or uncle or anything like that. We don't care. We're only counting up until the child is 18. We count the income and resources of the parent or step-parent if the parent or step-parent is living in the household, okay? But if they're not, someone else is caring for the child and there's no parent or step-parent there, we're not counting, we're only counting the income of the child. All right, we need to know if the child leaves the US. If you take your child outside the US, I recommend a trip for less than 30 days. If they are outside the US 30 days or longer, then we have to suspend the SSI and the Medicaid until they are back in the US for 30 days. If they go into an institution and they're going to be there for a month or longer, you need to let us know, or changes of address also. Okay, so how do you apply for SSI? Go to ssa.gov or socialsecurity.gov. Right there, you're going to see some pictures. One of the pictures is going to say SSI. I call them icons. Click on that, and that will tell you. Actually, you'll have the option of either applying for SSI online, or do you just want to leave your name and phone number and have someone from Social Security contact you to set up a date when you can complete the application by phone. We don't need medical documentation, but we do need names, addresses, and phone numbers of medical sources. So you don't need to provide a copy of the medical report. A DDS will contact the doctor to get that information, but we do need names, addresses, and phone numbers of your medical sources so DDS can contact them. Now, sometimes the medical portion of the SSI claim can always be done by phone, but sometimes, online, but sometimes the non-medical portion requires you to contact the Social Security office and complete the application by phone. All right, so let's talk about Social Security. We're talking about SSI. That check comes on the first of the month. It provides Medicaid, a lot of questions about income and resources. Now we're talking about Social Security. Social Security is a pension program, okay? Somebody has to have earned it. So in order for a young person with disabilities to get Social Security, they either have to have a work history, or one of their parents was deceased or is deceased and has enough work credits, or one of their parents is receiving either Social Security disability or retirement, okay? So a lot of times I would have parents tell me that their children are receiving Social Security, and I'd say, are you or your spouse getting Social Security or either a disability or retirement? No. Is your spouse deceased? No. Does your child have a work history? No. Well, then your child is not getting Social Security. Okay, they're getting SSI. All right. So the Social Security checks come on the third of the month, and your child can only get them if they have a work history, or one of the child's parents is deceased with enough work credits, or is getting disability or retirement benefits.
Andy, I just want to sincerely apologize to everybody. I got word through a text that our chat box feature was not working until just recently. So I have fixed it. We do have a ton of questions. I'm getting through some of them on my own here in the chat. I'm answering as many questions as I can. But when you're ready to take a few, if you'll just let me know, Andy.
Sure, go ahead.
Okay. How about this one? And thank you so much to Deborah, who called the office and told them that the chat box is not working. Okay, so my son just turned 18. He's been receiving SSI for years already. We haven't received anything in terms of redetermination. Should we go ahead and reapply or wait until they send a packet to us?
Wait until they send the packet. Yeah, sometimes it's somewhere between 18 and 19, they will send a packet. So yeah, that's the way it's going to be. That's what happens. You don't have to contact. Now, if they turn 19, then you might consider contacting Social Security, but usually between their 18th and 19th birthday, you'll be contacted.
Perfect. Now this one's a little bit more involved. So if a child is receiving Ssdi based on their work credits, and then they start working half-time, and they're also receiving retirement benefits from their father who has retired, and they're on class, what is the maximum dollar amount the child can receive and still be able to get those class benefits?
See, I don't know, because the class is administered through the state. So you'd have to contact Texas Health and Human Services, or maybe CPG can give you more information, but we don't have information about that because it doesn't come from the federal government. So we don't have any control. All we do is tell the state if the person is approved for SSI, hey, this person is approved for SSI, give them SSI. But as far as class and those waivers and everything, we don't have anything to do with that. We just tell the state that they are eligible for SSI and therefore eligible for Medicaid.
Okay, and you said the maximum amount and someone on SSI could get paid would be about 13.
Between if they get SSI and Ssdi, the most they can get between the two checks is $861. Not a whole lot of money between. But again, if they're under a PASS, the Plan for Achieving Self-Support, use Social Security to pay for their schooling, it is possible that they could be getting $1,000 from Ssdi and $841 from SSI, so their total income would be $1,841. That is possible, okay? But normally, if they're not working or anything between the two checks, what happens with the Social Security, we don't count the first $20 because it's unearned income. It's income that doesn't come from wages. So we don't count the first $20, and then whatever's left, we subtract from the 8, and then they get paid in SSI. So if you take the Social Security amount and subtract $20 and then subtract that from the 841 and you get a negative figure or a zero, then they're not going to be eligible for SSI unless, like I said, they do participate in one of these programs, and then it would be then it's possible that we would not count all of their SSDI income, and then they could have more than the 841 or 861 that we would normally pay for the two checks together.
Now, is there a special form for helping figure out self-employment income, or is it just from your
okay, well, basically the rules of self-employment say for self-employment, we count net income. So, I'm not an IRS person, but so you would take your gross and whatever your business expenses are, you subtract that from your gross, and then that's what your net income is. So that's what SSI would count, or SSDI, both. If we would count the net income that a person. So after they get through, subtracting their expenses, then whatever's left. So the person might make $1,000 a month, but maybe their business expenses are $400. So then we would count 600. That's what we would count. We would not count the whole 1,000 because it's different. See, with a person that's an employee, we take the whole gross amount and then we subtract 85 and then divide by 2. But with the self-employed, we take the net amount, subtract 85, and then divide by 2, and whatever's left is counted against the SSI.
Okay, fantastic. Goodness, I'm trying to get through as many of these as possible, and I know we're a little bit behind on these questions, so I
Let's take
really,
one more and then
one
I'll
more,
continue and
okay.
then we'll
I'm
stop.
looking for one that I can't answer myself. I'm answering as many in the chat as I can. Can you, I had a family once apply and they told me that SSI let them know if they got approved, they would no longer be eligible for Medicaid. Does that sound right to you?
No. Okay, even if you're, suppose your child was on SSI, okay, and now they're informed that they're going to be eligible for SSDI, not because of their own work, but because their parent started getting disability, or their parent passed away, or their parent became eligible for retirement benefits. If one of those situations occurs, if that's the only reason the person was cut off of SSI because their amount of SSDI under their parent is going to be over $861. So in that case, we can still keep them on Medicaid. That's called the Pickle Amendment. And that they can still stay, they still have to keep the SSI rules as though they were still on. But now, even though they're getting an SSDI amount that normally would not let them be on the SSI program, they can continue with the Medicaid. And after 2 years, they will actually be on Medicare. Okay, so let me just continue here. If a child is under 18 when the parent dies or starts getting disability from Social Security or retirement, the child gets benefits by virtue of being a minor. No disability needs to be proved, okay? We're not judging anybody to be disabled under 18 under the Social Security program. Just for being a minor, they're going to get benefits under their parent if the parent is collecting or has passed away, all right? So suppose you have a child that's that's on SSI and they're over 18, okay, but now the parent starts getting, Social Security. The child, even if they're over 22 years, even if they're in their 20s or 30s, whatever, as long as they can prove that they have a disability which began before age 22. So they could be 40 years old when their parent either starts getting retirement benefits or starts getting disability or passes away. So as long as the 40-year-old is unmarried, unable to work or do a lot of work, do substantial work, and they can prove that that disability began before they were 22 years old, they can receive SSDI under their parents' disabled adult child. Okay. And after 2 years, they come on Medicare. Okay. So not Medicaid, but Medicare, that red, white, and blue card that we give to senior, anybody who's on Social Security disability for 2 years comes on Medicare. Okay. Can a person get SSI and SSDI at the same time? Yes, they can. But the two together can't exceed $861 unless they're under one of those special programs that I just mentioned. Okay. And the countable income here in Texas, the highest amount of SSI is $841, SSI by itself. Okay. And this is what I just talked to you about, that sometimes young people who are on SSI get cut off because now they become eligible for SSDI under their parent. If that is the case, and that's the only reason they got cut off, because the amount under the parent is too high to continue with SSI, they can continue with Medicaid. All right. Now, if a young adult goes to work, they might, at a certain point after 2 years, get enough credits to be what we call insured for Social Security purposes. That means that they can receive Social Security because of their own work. Normally, if you're over 31 years old, you need at least 5 years out of the last 10 to be able to get Social Security disability, SSDI. But in the case of a young person, for instance, if you're under 24 years old, all you need are 6 work credits and then you would be eligible to receive your own Social Security. And, you know, as I said before, Social Security provides retirement, survivor, and disability benefits to workers and to their families. So if a worker is at least 62 years old and has 10 years of work, they could collect their own Social Security. And if they do, if they have children under 18, the children automatically collect under them. If they're over 18, if they have a disability and that disability began before age 22 and it doesn't permit them to work and they are single, they could receive benefits under their parent, possibly for life. Okay, we don't need to go over that one. Okay, and as I said, a person who's on disability, Ssdi from Social Security, oops, how'd we get there? Gets Medicare after 2 years. Now, Medicare has 4 parts, A, B, C, and D. Part A is free. That's the hospital benefit, covers the first 60 days in the hospital, but there is a deductible. Part B covers 80% of the doctor benefits. Okay, so that's what's called original Medicare, A and B. Now, Part B is $170.10 every month, okay? But if, let's say the child is on, they continue getting Medicaid, maybe the Social Security under their parent threw them off of SSI, but they continue with the Medicaid. If they have the Medicaid and they come on Medicare after 2 years, the Medicaid will pay those premiums of $170.10. So the Medicaid will cover that. Now, if a person has original Medicare of A and B, they don't cover drugs. So if you want a prescription drug plan, then you go to Medicare Part D. So Part A and B come from Social Security. A person who is on Social Security disability, Ssdi, for 2 years will send you the Medicare card automatically after 2 years. You don't have to do anything. All right, but that doesn't cover you for drugs. So for drugs, that is Part D. So for that, you'll have to go to Medicare.gov or call 1-800-Medicare, and you can sign up for Part D plan. That's generally about $30 a month, and they have copays and deductibles. Now, Part C, those are the Medicare Advantage plans, also known as HMOs. So if a person is on A and B or A, B, and D, and they want something that's going to be a money saver, they can switch to Medicare Part C, and that includes a drug plan. And that usually costs, it's the $170.10 that Social Security was taken for Part B. That's turned over to your Part C, and Part C covers A, B, and D. Okay, I know that's a lot to take in, but that's just something for your information. Okay, so here's how to get a hold of Social Security, socialsecurity.gov or SSA.gov, or call our 800 number, Monday through Friday, 7 a.m. to 7 p.m. But the 1-800-Medicare number, which is 1-800-Medicare, that's that. But don't call Medicare between 9 and 5. Call them after dinner. Call them at 8 o'clock, 9 o'clock, 10 o'clock at night. You're not going to have a lot of competition. During the daytime, it's hard to get through. Our number, I would say, call between 7 to 9 a.m. or 5 to 7 p.m. 7 to 9 a.m. or 5 to 7 p.m. is the easiest way to get a hold of us. Do not walk into the Social Security office. Make an appointment first, because then your waiting time will not be long. Otherwise, we have at the present and I know in the Houston area, we have long lines at all the offices. Those are people that show up without an appointment. Okay, so Michelle, do you want to read me some more questions there?
Oh gosh, there's just so much. There's a lot of people who would love to reach out to you, would love to know if you do consulting. I don't know if you're willing to share your contact information.
Sure.
But they have, everybody's got specialized questions.
Yeah. Up until July 30th, you can reach me at andy.hardwick, HARDWICK.
I'm going to put this in the chat box.
SSA.gov. Andy.hardwick at SSA.gov. Okay. So reach out to me with your questions, email me your questions and I will try to answer them. Okay.
Perfect.
I don't know if what I do now is called consulting. I just give people good advice as best as I can. And is there any way to check the status of the SSI application? I see a question. Yes, you can either call the 800 number, or if you have a My Social Security account. But see, if you're applying for someone that needs a payee, you can't really do that. So probably just call the 800 number and they'll be able to give you the information if you're that person's representative. How can we contact after you leave? Good question. Call the 800 number. Now, after I leave, there will be a person that will replace me. Okay. Unfortunately, they didn't, I hung around so long because I was waiting to train my replacement, but sometimes with COVID, everything's been slowed down. So I don't know at this point who is going to be the new public affairs person, but we will, I'll let you know, or Allison can contact me and I'll let her know, and then she can share that information with you. And that person will be more than happy to do these kind of presentations and answer your questions. Okay.
What can people use their SSI money for? Anything? Some people are asking,
Well,
if
the
they
first
have a
thing,
van,
food,
like the parent has a
food,
van.
clothing. Okay. If the van, yes. First, food, clothing, and shelter. That's the basic needs. If those are taken care of, if there's a van that needs to be repaired and that van is what the person uses to get to work or get their treatment, that would be okay. But save the receipts, because SSA, when we do the reviews, we might ask, well, you spent what was that on? And as long as you have the receipt and it was something, but it should be something that benefits the person who's disabled. Okay. So first thing should be food, clothing, and shelter. Once those are met, and you could, even for entertainment items for them on their behalf, okay, that could be done.
Very good. Thank you. There was a good one here. Can you talk a little bit about DAC? Well, it's not called DAC anymore, Disabled Adult Children.
Disabled Adult Child, yeah.
And how
it's childhood disability benefits. They have different names for. DAC is Disabled Adult Child. It means a child who has reached 18 and who has a serious disability who cannot work. But it could be, like I said, a child at 40, that maybe when this person is 40 years old, one of their parents passes away, and now they're eligible for survivor benefits as long as they can show that they have a disability that began before age 22. Well, how would we do that? We'd have to go back to the medical sources before they turned 22. So that could be the school districts or hospitals, doctors, whatever records we could see. So we could prove that disability began before age 22. And if that's the case, even at age 40, they could receive benefits under their parent.
Okay, I've got that one. Deborah, I'm going to be sending you a message. So if what they're eligible for is less than what they can get under their parents' record, then they get the higher benefit, or they get
the higher. Yes. If they get, even though they may be eligible for something on their own, if what they can get under their parent is higher, then we'll pay the benefit on the parent. Now, remember, to get benefits on the parent has to be collecting or has to be deceased with enough work credits. Because if that's not the case, then they can't collect. I can't get benefits under my parent if my parent is not collecting or deceased. Okay.
Very good. I'm going to just share. Are you finished with your slides, Andy?
I am. Yes.
Okay. I'm just going to share this last slide, which is how to get in touch with Consolidated Planning Group. There's a lot that we do, which will come through in the slideshow that's going to be sent to your email addresses. Everybody who registered is going to get this in their email. If you would like to set up an appointment with Consolidated Planning Group, or if you want to contact us for any additional questions, I'm just going to set that there while I get to more chats, I hope. Okay, this one had, oh goodness. Karen, I think that I will copy your question. Thank you for taking the time to type all that out, but I will copy that and get back to you because that's a lot of question you've got there for us. I will get to it. So fair share versus rental agreement. What do you think about that, Andy?
Well, that's a way of getting around the fair share. If suppose you're, again, remember that household I mentioned about $4,000 a month. If the parent makes an agreement with the child, with the young adult, and says, okay, I'm going to charge you $600 a month for room and board. Okay. So that's like a rental, that's like a rental agreement. And they go to SSA and they say, okay, my child, we've come to an agreement. They're going to pay me $600 a month for room and board. Okay. And if that sounds fair to SSA, that's okay. Now we consider the person as living in their own household, like in an independent unit, even though they're still living with their family and everything. But now we can consider them as though they were living alone. And then we could pay them the highest amount of SSI if they have no other income of 841 rather than that $600+ that they would get from the original determination that they were living in someone else's household because they couldn't pay their share of the expenses.
We have gone over by a minute. I really, truly appreciate everybody who showed up today. And Andy, thank you again for a fantastic webinar. Way, way, way more information than we can even process. It's like drinking from a fire hose, but it's so important. Andy's email address has been posted in the chat box. Is it Andy.Hardwick? Did I do it wrong?
Andy. Yeah.
Okay,
Hardwick,
Andy.Hardwick. I forgot the dot. Sorry.
Okay.
And mine is mmorris@cpgcares.net. We're trying to get to as many of you as possible, but it's just, with 100 people here, it's hard. But Andy, we appreciate you so much. If anybody else has questions, please reach out to either Andy or I. If it's an easy one, shoot it my way. Give Andy all the hard ones.
Okay, thank you very much. God bless you all. Have a good afternoon.
Thank you so much. Bye-bye, Andy. I'm just looking and seeing what last few questions are here. I know you all want to get out of here and get back to life, but yeah, feel free to reach out to me or to Andy, and we'll sneak that information to you later. Have a great day. Thank you so much for being here. The emails have been shared. We'll see you soon. Bye-bye.